Hi, my name's Eva, and I'm a research coordinator here at Mass General with the Yonker Lab. Today, I'm going to share a little bit about the work we've been doing to find out whether characterizing monocytes might be helpful in aiding the diagnosis or rule out of multisystem inflammatory syndrome in children among kids presenting with fever. Monocytes are a really interesting topic of discussion for inflammatory and infectious concerns because they migrate rapidly to sources of inflammation or injury. So they're part of a robust immune response. Even prior to the COVID-19 pandemic, a lot of work had been done looking at monocytes and sepsis in adults. And in fact, a measure of monocyte activation, known as monocyte distribution width, or MDW, has actually been identified as a predictor of sepsis in adults. So when adults come into the emergency room, those with higher MDW values are more likely to have sepsis than those with lower ones. And what MDW is it's a measure of the variation of the size of monocytes. So when you have a more diverse population of monocytes in terms of their sizes, of their morphology, you have a higher MDW. Given all the morphologic and structural changes that have been observed in COVID over the course of the pandemic in monocytes, we wondered if MDW might also be a helpful predictor of MGHfC in children, given the sepsis-like qualities of the illness. And as many of you may already know, MGHfC is the severe inflammatory syndrome that follows after acute COVID-19 infection characterized by fever, COVID-19 exposure or COVID recovered status, multisystemic involvement, and the absence of an alternative diagnosis. MGHfC comes with risk of severe cardiac complications, including myocarditis and shock, making it so important that it's treated quickly. Across 4 clinical sites here in Massachusetts and in Maryland and Florida, we enrolled 700 kids, many of whom presented with fever, 47 of whom had MGHfC, and a number of healthy controls. And we actually showed that MGHfC is a predictor that MDW is a predictor of MGHfC among children presenting with fever, and that there's a significant difference between the MDW values for children with MGHfC and those with other infectious or inflammatory processes. And when we look at the receiver operating curves for MDW in the MGHfC and infectious inflammatory populations, we actually find that it's a stronger biomarker or indicator for MGHfC than ESR and CRP, which are currently used in algorithms to diagnose MGHfC or rule it out. Importantly, we also found that MDW values decrease as MGHfC patients are treated and as they recover, and ultimately the monocyte anisocytosis returns to a baseline level. This is obviously clinically important because of the complexity of diagnosing this multisystemic illness and the urgency of it, given the possibility that patients might develop severe complications. Importantly, because MDW can be run in the context of a standard CBC panel, it minimizes the additional blood tests that need to be ordered for children to ultimately receive treatment if it's called for.